Hello, my name is Dean Parisi. I'm with the American Medical Association. I'm the Director of Health Solutions. I'm joined today by two representatives from the Department of Health of Abu Dhabi. I'm pleased to say that we are in Abu Dhabi today in the United Arab Emirates to talk about the progression and development of the Department of Health of Abu Dhabi over the past 10, 12 years, as well as the adoption and the implementation of CPT, or current procedural terminology, and how that is aided in the development of the organization and delivery of healthcare in the Emirate. I'm joined today again by Dr. Bashir Aden, an epidemiologist as well as a physician, and Dr. Anderson Sanciole, who is a health economist. Good afternoon.
Good afternoon, Dean. Welcome to Abu Dhabi.
Thank you. So, Dr. Bashir, if you can briefly introduce yourself.
Yeah, thank you, Dean. My name is Dr. Bashir Aden. I've been here in DOH, Department of Health, for the last 12 years. I have different roles and functions throughout my work in DOH. I started as a public health epidemiologist, moving to quality, and now I'm leading the healthcare sector strategy department in the data management and statistics.
Thank you. Dr. Anderson?
Yes. Hi, Dean. My name is Anderson Stancioli. I'm a health economist by training, and I work here in the Department of Health in the Executive Affairs Office, where I'm an advisor to the chairman, and then my focus is on health financing.
So our first question today is directed to Dr. Bashir. So Dr. Bashir, you said you had joined the organization in about 2010 and have seen presumably tremendous transformation and innovation within the department, as well within the wider healthcare delivery system within the Emirate. Can you talk to us a little bit about some of the changes in innovation and the initiatives that have taken place over your time, your tenure with the organization?
Yes, we have witnessed tremendous change from 2010, 2011, when I joined, to today where we are. We have moved from manual data collections to automation process. We now have connected all the healthcare providers into one platform. Because of the use of CPT, the DOH was able to standardize the data, ensure that the data is sustainable, but also ensure that those data that we collected, everybody reports in the same format. We have seen a lot of growth from healthcare capacity. We have about 3,000 professionals, clinicians from 2011, and now we are moving up to 10,000, 11,000. So the growth has been increasing for it. From healthcare utilization and how the health service is being utilized, we moved from 2011, 2007. Now every one of us, or every one of healthcare facility right now, are using claim submissions. So we increased the utilization for healthcare system from 2011 to 2019 to 99%. So because of this data standardization and the use of systems or nomenclature that allows us to understand, we were able to connect and move from manual collections to automation process.
So Dr. Bashir, it sounds like the innovation within the department is underpinned in particular through the adoption of medical terminologies, particularly around CPT, or current procedural terminology. Could you give us examples, or maybe one example in particular, of how CPT has been used within the healthcare delivery system?
Yes, one example would be healthcare quality. We've been using the data for CPT to enjoy the validations on how we monitor the healthcare service provided by different providers. So this usage for health CPT, we can monitor how the service has been delivered, care has been utilized, and quality has been performed for it. That's a good example I can give it to you. We can also use for the Malafi exchange data informations. There's a language that everybody has to use for it. Well, with that CPT use, we were able to connect most of healthcare providers into Malafi's health system.
So Malafi is your health insurance exchange, correct? That has been adopted.
Health information exchange.
Health information exchange over the past couple of years that connects your public and private, basically a single patient record that's able to be used and identified through the entire Emirate.
Exactly.
Is that correct?
Yes, exactly. So this kind of information, this kind of platforms, the providers can see records for everybody they want to see for. As a physician, you can see your patient have what they've been using for it, what kind of service they've been utilizing for, what kind of drugs they're using for it. And as a payer, you can see what service has been done before. So it is two-way works on services to be provided, care how it's being delivered, and how the cost is being contained for it.
The next question is for you, Dr. Anderson. As a health economist, we can't deny the past couple of years have been quite challenging with respect to the COVID-19 pandemic and the strain that it has put not only on populations, but also departments of health, health regulators, and ministries of health. Can you give us some insight in terms of some of the initiatives or programs that the Department of Health enacted, again, to support your population within Abu Dhabi?
Yeah, indeed, the last few years have been extremely challenging for all of us, and we have felt that, unfortunately, many lives that were lost. However, Abu Dhabi has been consistently ranked one of the top 3 cities globally in terms of the effectiveness of its COVID response. And the CPT, as a critical tool that we use to manage our system, has been very important in that process. Early on in the pandemic, we identified the need to protect the most vulnerable members of our society, patients that were elderly or had chronic diseases that required special attention. And using the CPT and the Malafi, the Health Information Exchange, with detailed records for each patient, we're able to identify those that would require more care and attention, and to provide targeted, specialized support to them with telemedicine services, the home delivery of drugs, and other types of support that helped those patients to avoid exposure to the risk of infection. And as a result, we had one of the lowest mortality rates in the world. Another example of where CPT has helped us is with early on again, the new code set, which included the codes for testing and later on for vaccination, that helped us to rapidly build our capacity to test and to isolate and to provide care for infected patients, meaning that Abu Dhabi had one of the highest rates of testing, vaccination, and one of the lowest rates of infection and mortality in the world. And I think, like I said, the CPT has been a very important instrument and an important partnership with AMA to enable us to do that.
Yeah, thank you, Dr. Anderson, for that insight, and congratulations on the work that you've done with the Population at Risk program. When we talk CPT, we talk about how it's an evidence-based, physician-led process that keeps pace with modern medicine, and I think those are 2 great examples of exactly how it does just that, keep pace with modern medicine. So as we look forward, and we look at how populations continue to increase across the globe, as we look at the proliferation of technology and the impact on healthcare delivery systems, as well as the rising expenditures related with care. Dr. Bashir, take us through a look into the future, right? One thing the COVID-19 pandemic has demonstrated to us is the importance of digital medicine and telemedicine, and be able to extend care from a physical environment to a virtual environment, let alone additional advancements in genomics, or what we call at the American Medical Association, augmented intelligence. Can you give us a glimpse into the future, some of your initiatives and programs as it relates to the Department of Health?
Yeah, the DOH is doing a lot of programs. One of the main things that we develop is the Research Center, Research Innovation Center. This Research Innovation Center are designed to investigate or actually future information on how care is being utilized for it. We developed Center of Digital Health, where the pharmaceutical company or academia or researchers can come in and get that information for, so they can forecast and predict what will be the use for it. DOH already have platforms for digital health and remote care control. So we wanted to deliver care where the patient is. We don't want patients to come in as usual to the visit to hospital or to their primary care. That will continue, but we try to minimize as much as we can. We're going to deliver care where patient is, not where they have to be. So this kind of information, the only thing that allows us is to have a qualified or standardized data, and the use of CPT, it allows us that we have evidence on how to deliver care. And that is, I think, what the DOH is positioned right now. We have tools to do it. We have a plan to do it, and we already have an infrastructure platform that we developed, such as digital health, Malafi, and data lakes.
Dr. Anderson, we could talk for hours about the future and what the future holds. From a health economic perspective, I'm keen to get your thoughts, and we'll give you the last word.
Thank you, Dean. I think Dr. Bashir highlighted some examples that are really helping us to shape the future of the health sector in Abu Dhabi, including the Centers of Excellence, the genomic program, and the life sciences industry being an important driver of economic growth in our emirate. Right now, this week, our chairman is leading another delegation that is visiting the US in order to promote investments in life sciences industry and in the health sector, which we see as a strategic and very important element of the next phase of development for the country and for the Abu Dhabi Emirate. So I also wanted to highlight that CPT, as part of our relationship, provides a very important basis by giving us access to timely, reliable, and actionable information, which is really critical to enable us to do planning for the next phase.
Thank you, Dr. Anderson, and thank you, Dr. Bashir, for an overview of how the organization has developed and innovated over the past 12 years. And equally important is what the future holds. Again, on behalf of the American Medical Association, I'd like to thank you for the conversation today and look forward for years of additional collaboration. Thank you.
Thank you, Dean.
Thank you.